Hi and welcome to Hoxton Therapy. This is a narration of one of our articles. UK set to suffer from more mental health issues in the second lockdown than before. As we enter the second lockdown period, it is obvious that symptoms of mental health distress are getting higher than they were during the earlier period of the pandemic. A study from the digital platform, 87%, that provides businesses and their employees with mental health monitoring and support revealed that UK labour force is struggling with the mental crisis due to COVID-19. When the lockdown began in March, 87% had been monitoring the changes in the sentiments and emotional reactions of thousands of workers. Many of these workers are in medical units of many organisations, e.g. Royal College of Emergency Medicine. It is unfortunate, despite having to change the work environment in the last 6 months, anxiety levels, feelings of isolation and fatigue, which people were experienced during the first phase of the pandemic, were not only very high, but still increasing. The levels of anxiety during the time has grown 12% higher than what was reported earlier periods of the pandemic. The findings is evident in the reports made by 87% from their ongoing tracking and assessment of companies' workers. The prevalence levelled up by August, but following the announcement of the second lockdown, it skyrocketed. People are more nervous, stressed, scared, and tensed about both their personal work and work-related situations. Middle-aged men and women aged between 36 and 45 are the most badly hit, and more men than women are potentially impacted. Anxiety levels for males on users of the 87 platform shows to have risen by 15% as compared to women who have 10%. Similarly, self-report about feeling lonely is also on the rise with more people, 15% higher, feeling more isolated now than when the pandemic first started. Another poll of users revealed that nearly half of the workforce reported that they are feeling emotionally isolated from others, particularly those 18 to 25% who are affected the most. Ideally, loneliness most affects women within that age range. Like other reported symptoms, rate of fatigue has also increased by 14% across all of the workforce assessed during the study. 47% reported having less energy than usual, with women reporting less energy than men. Many organisations have adopted putting many measures that will help prevent such problems, like setting up mental wellbeing benefit and plans, first aid, periodic medical check-ins and training on work-life balancing. Sadly, this data does not only help to prevent mental illness. Virtual Forge, one of the organisations engaging in the services of 87% to monitor its employees' mental health, is an innovative technology service provider. Its co-CEO, Garrett Doyle, disclosed that, open quotes, the findings on the workforce mental health showed the reason why individualised, specific approach is needful to tackle increasing mental health problems across the workforce. There is a need for data to increase our understanding of the rising trend of mental issues, particularly this second lockdown period. Company workers are struggling with a lot of problems such as worry and fears. Without data to provide information on these, we are stuck at responding to the issues as they spring up. Schemes like assistance programs for employees aren't enough anymore. We need to innovate new trends as they appear in order to set up preventative measures and prevent another pandemic, that of employees' mental health pandemic. A positive trend is already being recognised among the declining mood of the people as workers are becoming more self-aware. Added to the regular assessment of mental well-being is that through creation of a team of psychologists, more users of 87% app can be personalised advice on several aspects of their lives. In March, the most popular program was Happiness, but currently Managing Emotions. Clinical Director of 87% and the member of the British Psychological Society Executive Committee, Dr. Sarah Pitts, described, open quotes, as COVID-19 first became our concern, people were very more inclined to turn towards assesses their quality of life and feelings about themselves. Our reflection has evolved as our feelings about the virus and circumstances it has impacted on us has changed. Now, people are more focused on dealing with difficult emotions like anger, frustration, uncertainty. Putting this view, it is clear that people recognise they're feeling lonely, fatigued, fearful, and making efforts to cope with the circumstances that come along with this current period. To aid people in recognising the need to be mentally fit and resilient during the second lockdown, an initiative, 3Form, was launched. The goal of 3Form is to enable users to develop self-awareness by devoting 3 minutes daily on developing and building a positive mental health. 87% CEO Andy Bibley added, open quotes, "There is guidance on what is needed to stay both physically and mentally fit, but about mental health, there is more we need to do as life can get entangled and busy with a lot of competing demands for our time. Resource and energy making it harder, prioritising our well-being. 3Form does all of that. It's simply the mental health equivalent of balancing a diet. The program is designed simply, very practical and effective, and will help people build mental fitness and resilience by spending 3 minutes daily doing specific things that help your mental health." Close quotes. Supported by scientific findings and a host of psychologists, 87% seeks to improve employees' mental well-being and to generally benefit the society via increased productivity and engagement. In accordance to the report that only adults, 13%, are living with equally or quality mental health, 87% serves to strongly support the rest of the adult population, community culminating the remaining 87%. The services it renders includes customized content via 87%'s app, daily interactions, weekly reports on mental fitness, and podcast series. Never act on any advice given in these articles, videos, or audios. Always seek professional help before acting on anything you read or watch or listen to on this website, or in our podcast, or on our YouTube channel, or anywhere on our social media.